Hi, my name is Nicole Dossie, and I'm the Executive Director of the NCADA. Thank you so much for joining us for our annual Remembrance and Resource Event. Although this event is held in a different way this year, virtually, our purpose remains the same: to provide hope to those in recovery, to honor those who have lost their lives to substance use disorder, and to provide resources for those who are in the midst of this battle. We're going to start things off honoring those people who have lost their lives with a song from my dear friend, Erin Bode.
I know it's hard sometimes, and things seem larger than they are. But if you need to tell someone, that's what I'm here for. Cry on my shoulder, I'll help you rise above. Cry on my shoulder, my love. And in the world outside, it can be harsh and cold. But if you need someone, I will be here to hold you. Cry on my shoulder, I'll help you dry your eyes. Cry on my shoulder, my love. I know it's hard sometimes, and things seem larger than they are. But if you need to let it go, then you can call on me. Cry on my shoulder, I'll help you dry your eyes. Cry on my shoulder, my love. Oh, cry on my shoulder, I'll help you rise above. Cry on my shoulder, my love, my love.
My name is Dr. Kanika Turner. I am currently the Associate Medical Director of Family Care Health Center. I am also the creator of the Faith-Based Opioid Initiative in St. Louis. A typical day for me is pretty busy. I am a family medicine physician, so I practice full scope family medicine. One caveat, I'm a huge proponent of addiction medicine and primary care, so quite a few patients that I care for with substance use disorders. And I also practice obstetrics, so I take care of a lot of pregnant moms with substance use and then also see their babies afterwards. So typical day could be rounding at the hospitals and then going into clinic, taking care of patients, taking call, maybe a delivery later on in the evening. So it's a typical day, and then of course study in between. Right, so I got involved with the faith-based community. It actually went back to when I was in medical school. I started some health ministries at different churches, but I was actually approached by Dr. Fred Rotnick and Dr. Rachel Winograd to join in with them to help lift the faith-based community, specifically for substance use. And the focus at that time was on the Black community. It was very difficult to penetrate information when you look at either those that's in recovery or even those that's actively using. It's a huge spiritual component. And when I initially approached the pastors and preachers in the area, I was actually nervous and I thought they were gonna reject me. And come to find out, they were so welcoming and they felt like we need something. We need information. We need to know how to talk to people. So it just really opened the door. It was a blessing for them to want to listen to me. And as a result, it just opened up. I started doing trainings for churches regarding opioid use, naloxone distribution. Some churches had became established for naloxone distribution centers. So they carry naloxone there. We partnered with some churches that offer prayer breakfast or lunches, and they'll get a lunch bag and breakfast and also get some naloxone. So it was just a great, I think it was I shouldn't say the right time, because we were seeing a rise in opioid deaths in St. Louis City and St. Louis County. But it was because I felt like people wanted an outlet or wanted something different, a different approach to care that we haven't done before. So unfortunately, opioid overdose deaths are up among our Black males and Black females in both St. Louis City and St. Louis County. Huge disparity, inequities that's there. And of course, I absolutely cannot leave out the effects of systemic racism. COVID-19 uncovered that. And of course, our overdose deaths significantly increased as a result. And what do we do about that? We need a non-traditional approach to care. We need something completely different than what we've done before, because what we're doing now is not working. We're still seeing people die. And that number is going up. And even when we looked at before COVID, we saw Black males continue to rise by other areas, other, white males, white females, and even some in Black females, we saw numbers slightly decline. So we need something different. We need to destigmatize the messages, and we need a full community lift, not just our spiritual leaders, but those that's actively using to have a voice. If you're interested in treatment, if you're not interested in treatment, what does treatment look like? We need to completely revamp our services that we offer. A lot of times people try to separate, addiction treatment from primary care. Start to incorporate that into primary care. Train more family medicine, internal medicine doctors to feel comfortable providing care. It's really sad in medical school, we get like a short tidbit on how to take a social history, and then we skip over it in our plans. We talk about everything else, but we need to restructure our medical school systems, and so people will feel more comfortable and that they will look at any substance use disorder the same way we do with hypertension, diabetes, COPD. We need a very robust change. And the other issue I always think about too, once we get somebody into care, how does that interaction look between the patient and the provider? There's huge stigma, racial bias, even embedded in the hospital or the outpatient encounter. So how does that look? If we get them into your practice, are we discharging because of 3 no-shows? Are we discharging because we have multiple substances in our urine? But how do our current practices and policies look once we actually get somebody into care? So completely revamping and turning our healthcare system upside down. It's possible, but that's what we will need. Right, for those who are listening and watching at home, first, be an advocate. There are some simple things you can do. Change your language, your vocabulary. One thing I tell people, don't call people drug addicts. That can be stigmatizing. So changing your language. Naloxone itself is a nice discussion starter. If you let somebody know, like, I care about you, I want you to stay around, here's some naloxone. This is how you use it. Call me if you ever use it. That can be a huge talking point for all of our families. And go the extra mile. Go to the therapy sessions. Go to a doctor's office visit. Start speaking out on these issues, because believe it or not, it has impacted many of us and probably impacted our lives in some way we probably didn't even think about. But that will be a start.
Good evening. I'm Stafford Manion. I'm an alcoholic. Thank you all for joining us this evening at the virtual event. I've been asked to say a few things about my experience, so here we go. I've been in recovery for 18 years. I grew up in a family that drinking was, as in many families, accepted and kind of a rite of passage for a young man. I quickly accelerated my drinking and acknowledged that I was an alcoholic in my late 40s and went into treatment, and eventually the help that I reached out for worked, and 18 years ago on September 11th is my sobriety date, and I am eternally grateful for that. I sit on the board of the NCADA, I sit on the board of the Harris House. I am involved with the Lindell Club, so sobriety is a big part of my life, and I am really focused on getting my arms around my sobriety and keeping it and giving back to the community. I can tell you that the program of AA and the good work that is done by the people at the NCADA and many others has changed my life incredibly for the better. Getting into this, all I wanted to do was stop drinking and be a better father, husband, coworker, and just a better person. I had no idea of all the benefits that come with that I have been gifted with. The program is available to anybody. The resources that are out there that the NCADA offer and many of these other great organizations offer are out there and are available to anybody. The action needs to be taken by the individual to reach out and ask for help. There is help out there, there is hope, there is recovery. It is a disease that can be halted, and recovery is available, but the action needs to be taken by the patient. I learned this over time. I didn't get it right away, but after a series of failures, eventually I did give up, surrender, reach out, and tell people I needed help. And the help came pouring in at that point. The main message I want to convey this evening is that there is help available. There is hope for recovery for everybody. And it is out there, but you need to take action. You need to admit that you have a problem, and you need to be willing to reach out and accept help, and then take action in going to meetings and embracing the program. It's a wonderful thing. I'm eternally grateful to all the people like the NCADA, like the recovery system in St. Louis, the treatment centers that are out there, and all of my fellow members of AA. We do this together. Join our team.
Thank you, Dr. Turner and Stafford, for sharing your stories and the ways that you are personally contributing to the cause of substance use disorder. Your service on the board and your support of NCADA and all of the other resources in the community are immeasurable. So thank you very much. Many of you might be home and thinking that you're concerned about a loved one, or you might even be reflecting on your own behaviors, maybe developed during COVID as coping mechanisms, or maybe something that's been kind of lingering in your heart for some time. And you might be wondering, where do I go? Is there hope? Is there anywhere that I can talk to? And the answer is unequivocally yes. There are many resources, a lot of them at no cost here in this area. And I'm going to introduce to you a panel of experts, people who are experts not because they have achieved a certain degree, but they are experts because they are in this. They live this dedication day in and day out, trying to prevent what they themselves have experienced from happening to another family, trying to prevent any sort of anguish from happening to someone else, and trying to spread the message of hope, because there is hope. So now let me introduce you to some of my friends who provide sources, resources that our community desperately needs. we just wanted to take a moment to highlight all of the different resources that we have in the community. We know that several folks who are watching this tonight might be in the midst of their battle or fighting alongside a loved one who is in the trenches fighting this disease. So again, wanted to highlight some resources that our community has available. And I'd like to start first with the prevention side of things, or the side of things when perhaps somebody is just starting to uncover that maybe they're having some challenges related to their substance abuse. Haija is with the NCADA, and I'm hoping you could talk a little bit about the Early Teen Intervention Program and assessments.
So I am one of the counselor here. So we just recently actually changed our name from TCP, which is to stand for Transitional Counseling Program for the Adolescents, to Guided. After considering what our mission was about, because we changed our agency names. So pretty much Guided is we get a lot of referral from school. A lot of time we get referral from healthcare provider. It could be a pediatricians. A lot of time we get referral from the community as well. But mostly a lot of our referral come from the school. Parent or guardian can self-refer their kiddo to us in order for them to be part of our program. So the way the process works is, they will make an appointment, we'll get them on the schedule. The kiddo and their guardians or parent will meet with one of the counselor. We will do a thorough assessment screening to see where the kiddo is at when it comes to substance use. A lot of time it might be because the uses is where it's very intensive. It might be we have to do outside resources such as inpatients, outpatients, facility. And if the adolescent is where they just, experimenting, they just started using, it's not where it's very concerning for the counselor. That's when we enroll them into our program called Guided. So the program is structured to where the adolescents, and the parents are part of the workshop. We have a 6-week workshop where they have to come pretty much learn about prevention method and tools that can help the kiddos to pretty much not use or decrease their usage. At the same time, the kiddos and the parents is meeting with the counselor for individual therapy sessions. We check it in, how is school, how is home life. At the end of the workshop period, the counselor assesses the kiddo to see do they need any other alternative resources, that might be, the use is increasing. They might be referred to, maybe a family therapy, individual therapy, or inpatient or outpatient treatment as well. But
Is there a cost for that program, Haija?
No, it's free for the family. So normally we work with elementary school to high school kiddos. So it's free of charge. We don't charge the family for nothing.
Excellent. And now what if an adult is maybe having some difficulty with substances and maybe wants to come in for an assessment? Can you walk us through that process?
The same idea. A lot of time we get referral for adult from PO. It could be probation officer, parole officer. It can be from employment, or it can be from a carpentry school as well. We has worked with them as well. A family court, which deal with children divisions. A lot of the referral we've been getting recently is through the diversion program. So that program is pretty much designed to give somebody a second chance to get stuff sponged out of that person's record. So they will come, they will meet with a counselor. We'll pretty much do the assessment screening to see what level of care that person going to need. It might be outpatient substance treatment. It might be treatment for mental illnesses or trauma-related treatment as well. Or it might just be co-occurring disorder as well, or substance itself. So it's the same thing. The assessment fee for that is $25. But if an individual cannot afford the $25, we have a scholarship here where we can waive that. So that way, everybody's needs are met.
Excellent. Thank you so much. So let's say that one of NCADA's unbiased assessments reveals that an adult is in need of some treatment. One resource that they might refer to would be ARCA. Jordan, Hampton, can you talk a little bit about ARCA, please?
Yeah. So ARCA, Assisted Recovery Centers of America, is I like to look at it from the services that we can provide from that referral, right? So kind of a full spectrum, uninsured, insured, Medicaid, whatever the coverage is, that we will fit that category of, with us there at ARCA. But when you're referred to ARCA, you can expect to see a physician. You can expect to have medication the same day. You can expect to see a case manager also that same day if need be, which oftentimes, it's identified that, hey, this person is struggling, they're in active use, and they need resources. So not only do you need medication to halt the use, you need someone to advocate in your corner for food, for transportation. So case management, if you need to see a psychiatrist, that's available there as well. And also peer supports, which is a big component for us. It's kind of a big movement right now. It's there's a lot that one can identify with, and that peer support can really be the catalyst for all the other great services that are provided there at ARCA.
So speaking of peers, so Colton, you have lots of jobs, and one of your jobs is with the EPIC program. Could you talk a little bit about EPIC and the importance and role of peers in that program?
Absolutely. Thanks, Nicole. So the EPIC Outreach Project stands for Engaging Patients in Care Coordination. And what EPIC does, is EPIC utilizes certified peer specialists to respond to opioid use disorder calls from hospital systems. So EPIC partners with BJC, SSM, and Mercy hospitals in the 7 counties in the eastern region of Missouri. Anytime a referral is made for a person struggling with opioid use, they will have a peer on site within 60 minutes who can meet with that patient. They can provide resources, and EPIC prides itself on being able to schedule next day treatment appointments, next day access to medication, a peer support specialist that will follow them through their recovery process, and that's irregardless of insurance status. So uninsured, Medicaid, private insurance, EPIC will provide next day treatment resources to an individual with opioid use.
So Haija earlier mentioned that if somebody is unable to pay the fee, that there are some scholarships available. And some of those scholarships are available because of a group called Archway. So I'm wondering, Colton, if you could talk a little bit more about Archway and its role in getting folks into treatment.
Yeah, so the Archway Institute is a nonprofit organization that operates in 9 states. Archway, raises funds to be able to bridge the gap of people needing access to recovery. A lot of times we say the difference between recovery and not recovery is a couple $100, right? So Archway raises funds to be able to provide treatment access resources, right? And so, much like EPIC, the Archway Institute has Advocates for Hope. These Advocates for Hope are oftentimes certified peer specialists that are in recovery from opioid use, as well as, caregivers with experience with a loved one with, substance use disorders. So Archway really works on the 2 fronts, on raising money to provide access to care, along with, the support needed for the person in recovery and for their loved ones.
So we'll talk about the loved ones in just a moment. And I want to speak about somebody who has been successful in treatment and is now ready for that next chapter. So Jordan, could you talk a little bit about Recovery House?
Sure. Yeah, so, recovery housing is a huge component in this process. We've talked about a lot of resources thus far, and, the ongoing support is critical, right? So Recovery House is transitional living for men. We have 9 houses, and it's kind of a 2-tier process, right? So we have an intake house with a lot of structure, a lot of accountability, many house managers. And so you come, and that's where you get your roots planted. That's where you really feel the family atmosphere. There's groups every night. There's a lot of urine screens, like I said, a lot of accountability, a lot of peer coaching, a lot of one-on-ones. We're very tolerant to the disease of addiction, right? And so it's not a one and done, you relapse, you're out type of operation. We want to take that time as an intervention point, go back to the drawing board, see where things veered. Was there something that was added in that shouldn't have been added in? We revise and we move forward. So, after Humphrey, that stage could take a little bit longer than others. So there's no determined amount of time that you're at Humphrey, because what's in a person's best interest is different from the person, sitting next to them. So once you kind of graduate out of that stage, we try to be very personal as to where that person goes, outer house wise. Try to be very strategic as far as if Johnny's going to mesh well at this house because of the makeup of that house, then that's where we want him. We want to help bring the best version of him out around this group of people, and that's where they'll match. So they go to that outer house, and average stay I would say is roughly around a year or so. And but that same accountability, the same structure is still at that outer house, just a little bit more freedom. It's the stepping stone into, okay, I'm not transitioning right back into society. I'm not going from inpatient to trying to get a single bedroom apartment by myself. We're going to start with a lot of structure. We're going to go to the next step as an outer house, implement some new things, some of the same things. And the hope is that everything that you've gathered in that process, and while you're at this outer house, you say, okay, have I implemented enough in my life that when I take these things with me outside of here, can I sustain my recovery? And we sit down as a collective with the family, myself, and answer those questions together. And, that's the process.
And there are homes specifically for women as well, right? So if somebody wanted to be, we will have contact information up at the very end of this. And so if somebody specifically wanted to know about some female housing, I'm assuming they could reach out to you, Jordan, and you could direct them.
Absolutely. Yeah. I sit on the board of Missouri Coalition of Recovery Support Providers. And so I would love to be of service any way I can. And I've got a close relationship with a lot of the female providers. And so, yeah, I would be happy to help with that.
So we know that addiction can be at times a very lonely disease. It can feel very lonely. And yet what we've been talking about this whole time is really the community of support and the foundation to help people when they're fighting this disease. Ellis and Patty, I'm wondering if you could talk a little bit about the community work that you do. And you can take this any which way you want, because your movement has definitely evolved over the years.
Okay. Well, how we started out was we unfortunately lost our son in 2014 to an accidental heroin overdose. After he passed, and also while he was going through his active addiction, we didn't know of any resources. We didn't know who to talk to, where to go for help. And so we, when he was still alive, we ended up going on Google looking for rehabs online. And so we were really just going about it blind. And then after he passed, we were really in the same boat. We sat silent, not knowing that we were surrounded by people that were in our same situation. We thought we were pretty much alone in the world. We were ashamed because of the stigma. And after, I don't know, maybe a year or so, we heard of a program the DEA launched in St. Louis called Strategy 360. They were looking for community volunteers, family members, resources to come together and work towards trying to combat this problem, this drug epidemic, this heroin epidemic, they said. Well, honestly, that was the first time we had even heard that there was a heroin epidemic. We had no idea that it was so prevalent. And so that's when we reached out. And we reached out to them, and they put us in touch with so many wonderful people, NCADA being one of them, and an awareness group called Walking for Wellness that was out in the St. Charles area. So what they did was they spread awareness by sponsoring walks, and we decided that we would join with them and walk and just try to talk to people and tell our story. And once they closed Walking for Wellness at the end of 2017, we decided we wanted to continue the work of spreading awareness. So we formed HEAL Stop Heroin. HEAL means Heroin Education and Awareness League. And what we do is we also sponsor walks when we can. Because of COVID right now, we've been sidelined with that. And we set up a resource table at events, and we tell our story. We speak to people and talk about Michael and about our struggles and what we've learned through the journey, and hoping to enlighten others, especially other parents, on the things that we didn't know at the time that, had we known at the time, may have changed our situation completely.
And you also give out Narcan and drug disposal bags to help families make sure that as much as possible they can prevent you're doing what you can to prevent another family from going through what you went through.
Yeah, absolutely. That's another program that NCADS helped us out with, was training us on how to recognize overdoses and how to respond to them, and provide Narcan. The deterrent bags, you gotta, if you have them and don't need them, you gotta dispose of them properly. And if you do need them, lock them up.
Lori, I'm wondering if you can talk a little bit about how you have been using your voice and providing support to people, because I'm sure that there are several people watching who need somebody to talk to. So could you talk a little bit about what services you provide?
Well, Nicole, I'm just a mom. I had 3 sons. We had a pretty good life for many years. I'd say we were middle class America. And then alcohol and drugs snuck into my life. Unbeknownst to me, wasn't worried, wasn't even concerned about those things. My sons had a good life. I love my husband. We just celebrated our 34-year anniversary. So when my son started having a problem with these things, I thought perhaps it was a phase, things would get better, punishments, cell phones, cars taken away. Middle son started using prescription pills with alcohol, and his life starts to spiral down into a very dark place that, quite frankly, I didn't even understand alcoholism or substance use disorder. And I really, for many years, was tortured like the folks from HEAL. I felt ashamed. I felt stigmatized. What kind of mother raises children like this? And as I become more sick and more depressed, my closest friends are forcing me to get some help. Go talk to a therapist. You are justified to be upset. You are right. Something's not right with your family. So I get introduced to the Al-Anon Parents Path to Recovery, which first meeting I was there, I'm like, oh boy, this is where I'm supposed to be. These people are me. They're having the same problems. I'm not alone. And then from there, one of the moms introduces me to the Hope Group, the STL Hope Group parents, which wonderful people also. They take a very serious subject, which was the opiate, the heroin problem. And they make you feel not alone, not ashamed, a lot of good support. And then finally, my son, Mitchell Emery O'Brien, passed away January 27th, 2019. And we became members. My husband and I are members of SOUL, Surviving Overdose and Understanding Loss. And they are amazing people who, I guess you could say I've come full circle. I've been on all sides of the fence. I always want parents like me to understand that they're not alone. And there are a lot of good people out there that will, help you through this journey of pain. And I can't say that I can help save your child, but I'm sure going to try. I'm one who would advocate for sober living homes. I think the programs that they're offering, they've come a long way from when my son Mitch was first doing sober living. I like how if someone has a mistake, they rein them back in, they get them services, they get them help. They don't just throw them on the street. I think recovery programs have come a long way over the last decade. I'm not so sure we can stop heroin or opioids, but I think it's good that we're talking about it and, giving people a voice and trying to stop the shame and the stigma, because in my opinion, that's what's killing so many. If you can't talk about it, if you can't troubleshoot it, how can we get ahead of it? So I am just a mom who's involved with a lot of groups, also Walking for Wellness. I've done things with the NCADA. We've handed out the disposal kits, Narcan. There's just so many opportunities to help people. Phone calls, take calls, listen to crying parents, have them come over and do a socially distancing walk. The COVID has hurt people greatly because of the emotional. People need to be hugged. They need to be told they're not alone. Their family isn't unusual. This is the epidemic of our time. And I believe the numbers on how many have actually passed away have been fudged, and the drug companies, the pharmaceutical companies are very powerful. They want to pretend like the numbers aren't that high, and a lot of that's coming to light now also. But if we work together, we the people, we can do great things. And I'm not saying I can save anyone, but I can sure try to help save your loved one, your husband, your wife, your son, your daughter. There's a lot of support out there from just parents not just parents, people who've lost their loved ones.
Wow, thank you so much. And your comments actually led me into one of my questions, and this is really for anybody. Some of you have touched on it. I'm wondering how the current situation with COVID, economic downturn, social unrest, if that has caused a difference, not necessarily in how you provide services, but in the types of requests, the type of services that you're seeing, the types of phone calls that you're getting. Has it magnified them? Has it changed them in nature?
I think we're not being able to get out in the public, and that's a big part of what we do. And it's been especially since we don't have a storefront. I think people are a little skeptical about doing porch pickups and that type of thing. So it's cut back on what we're able to provide, I think, greatly. We're trying to reinvent ourselves, doing more virtual stuff. We did have a great International Overdose Awareness Day event this year. That caravan worked with Soul and with Colton and Jordan. So that was really the first thing we've really been able to get out in the public halfway, this year. So hoping that's going to change. And we'll probably start bringing her walks back regardless come, come spring.
Okay, we'll hold you to that. Jordan, have you been seeing maybe substances of choice change a little bit, or?
Yeah, a little bit. I mean, we've definitely seen, I mean, liquor sales are through the roof through COVID. We've definitely seen, and with that, actually, I have seen a lot more, and received a lot more calls for alcohol use disorder. It's shown itself. It's driving people. I mean, one, there's cross addiction, and there's two, I've seen the alcohol use disorder that, from guys or gals that has been their drug of choice, and they're now seeking help because it's just like the depression's gotten so great. Their alcohol use disorder was there, but with COVID, not being able to go anywhere, the depression is sky high, so then it drives them out and they're seeking help. So yeah, I mean, I have seen some cross addiction, even with the opioids. A lot of amphetamine stimulant use. We did a great job of trying to prevent deaths, and we prevented some. I wish we could prevent them all. But they, I think that while we were treating that, might have missed the mark a little bit with looking to see what that was going to do. And we, like, if we don't provide enough therapy, then this cross addiction could, be alcohol, it could be amphetamine. So now, I think that we've all hit the drawing board. We're all fighting together. We all have to take a look and like, what can we do better? And I think that that's where we're at now, is providing more therapy, more kind of that psychosocial component. I know that's what we've done at ARCA, and we've also had to ramp up how many people we're seeing a day. I mean, there's times where we'll see almost up to 15 new patients a day. And, a lot of phone calls for recovery housing has came in, and it's getting colder, and plus COVID. And so I think that it definitely takes all of us. It takes a unit, and we've heard a lot of great resources thus far. You've kind of heard a trickle, I guess, of services here. And so I think that, as a unit, that we can slow this epidemic down.
For me as a counselor, what I've been seeing is that, the lack of that interpersonal connections. Client will come into the office, interact with, with the receptionist, paperwork, and a counselor. What we learning is that the challenges of using technology, sometimes a lot of time people don't have access to that. So we have to be very smart about how we can get clients to complete their assessment, so that way they are following all their parole or probation requirement. So that way their legal, issue don't get worse. That has been challenging for a lot of clients. They don't feel comfortable with that. So what they would do is cancel their appointment instead of saying, oh, I need help because I don't know how to use the internet. I don't know how to use the Zoom. I don't even know what that is. Just the other day I was working with his clients. He was in prison for 14 years. I couldn't imagine being out after that many times I spent beyond bar. And now I have to learn all these new technology, and I don't have no idea how to even access it or how to use it. So clients are facing that because of the COVID too. So I am seeing that as a counselor.
Ellis, Patty, Lori, are you all seeing more concerned family members reaching out to you? I know that was something that at NCADA we saw at the very beginning. We had almost more calls from concerned family members because they now are stuck in a house with somebody and they're observing some patterns that might be worrisome to them. Have you seen more of that over time, or has that started to dwindle as people get used to this new kind of environment?
I don't think we've never had to field a whole lot of direct phone calls. I mean, like I said, most of our interaction has been face-to-face interaction. We've had a few people reaching out to us, lately, but I wouldn't say that that's up or down from what it's used to been with, with us. I mean,
Would you be open to more if more people wanted to reach out and talk?
definitely,
absolutely.
yeah. That's we've put out that on our webpage we've got out there, and I posted on Facebook that we're not trained professionals or anything like that, but we've been there, done that, and while we might not have the answers, we can tell people what we did, what may have worked for us, what didn't definitely work for us, that type of thing.
And share the resources that we have available
Right.
to us with them, and just sort of try to be an ear for them, and tell them that they're not alone, and there's a lot of help out there. Something we didn't have when we went through it. So I think it's really important for people who are struggling, whether it's with themselves or with their child or a spouse. It's so important for them to have people to talk to who have been there. And I think just the fact of just talking to someone is a big help. It's a big help relieving the stress and that first step into finding help.
Thank you so much for joining us tonight. Hopefully you found some resources and assistance that you can use. That's our goal for tonight. Thank you to those who participated. Thank you for joining us in your homes. We're going to finish with one more song from Erin, Bode and Viktor Krauss. And we're going to end tonight bringing up the resources that you just heard about so that you can linger on those for a moment and have the information if and when you do decide to reach out. Hope to see you again next year in person.
You just can't smile it away. It's much more than passion, oh, it's love. And I've heard some people say they've seen love move mountains. You just can't laugh it away. It's too deep inside your feelings. Oh, it's love, and not some game you can play just to laugh and go on your way. Let's sit and talk it over and work it out. I love you so. Can't we just talk it over and see what we can do? You can't just pass it away like some silly fashion. No, it's love, and love comes eager to stay. It just doesn't leave you that way. Let's sit and talk it over and work it out. I love you so. Can't we just talk it over and see what we can do? Let's sit and talk it over and work it out. I love you so. Can we just talk it over and see what we can do? You just can't pass it away like some silly fashion. No, it's love. And I've heard some people say they've seen love move mountains. Oh, it's love. And I've heard some people say they've seen love move mountains. No, it's love. And I've heard some people say they've seen love move mountains.